Hello and welcome to Chapter 10, Biomechanics, where we put everything together. All right. You've already learned the parts and the names of the parts, but now we need to see how the parts work together to create a combined outcome. Your book gives a pretty good example of a bike. All right. You know what a seat is on a bike, you know what a wheel is on a bike, but the wheel isn't the bike. The wheel is only part of what makes the bike work and go forward. The same thing with the human body. Think about walking. You need your bones, your joints, and your muscles. You need to know the names of the directions that they're moving, how they are turning, what is torsion, what is the name of the bone, what is the name of the joint, what are the names of the muscles. If you don't remember the meaning of the word as we go through this chapter, please look it up. We need to know all of these. This chapter is also about doing compression. How much force are we putting on our clients when we give them compression? How much pressure is being used during this massage on the variations of compressive load applied to the body? You've heard body mechanics before for the massage therapist. We need to be careful about joint stacking so that the load, the force of the load carries through your skeleton and not through a singular weak joint that can get damaged. So we are thoroughly going to cover kinesiology, again, is the study of body movement, but we're going to look at body mechanics, which is the study of the mechanical processes of human movement. Your book has a pretty good illustration of biomechanics and ergonomics for the massage therapist. This image is of box 10.1 in your chapter. And it says that biomechanical principles have direct application to therapeutic massage application. Body mechanics refers to the way we move our body. How efficiently the massage therapist uses their body will influence their career success. This is very, very true. All forces should be applied in the direction of the intended motion. During massage, when we point our feet towards the direction of the stroke, we are applying this principle. A total force is the sum of the forces of each body segment contributing to the act if the forces are applied in a single direction and in proper sequence with timing. This principle is important to massage-related body mechanics. When we stack the joints and are stable and lean forward from the ankles, we can apply more force with less effort. We want the force produced to move into the client's tissues, not be dissipated like in our own joints. That is why we need to maintain the joints in a stable position. This is especially true of the elbow. If you let your elbow bend when using your hand to apply the force, most of it is lost or absorbed. This is not a problem when we use our forearm for massage, as long as the shoulder remains stable. If one or both feet are not in the proper alignment, energy that creates the force will be wasted. We should have our weight distributed to the back foot with a concentration towards the heel. You need to stand up, avoid bending or excessive lunge positioning, especially avoid bending and reaching or twisting. That will hurt your back. The height of the massage table generally is measured to the practitioner's hip height. You need to maintain a symmetrical stance. The feet should be shoulder width apart with 1 foot forward. Avoid having the legs too close together or too far apart. Now, the table height is generally at the hips, yes. If you are doing a grand majority of light effleurage and things like body salt scrubs and things of that nature at a spa, You might want it a little bit higher so that you are not consistently bending because you're not going to be using that much force. If you are consistently doing deep tissue work and you are bending deeply at the knees as well as the ankles in the archer position and others like this, you typically have your table even lower. I know that the practitioner that taught me deep tissue and the way that I practiced for over a decade was to have the massage table literally as low as my knees. Now, the way that this woman is standing in this picture here, her legs are in a good position, but I would not recommend bending at the waist necessarily like this. You will start to feel low back strain. Please work with your on-campus instructors on proper body mechanics. And most importantly, pay attention to your body. Everybody's joints are different. I know that we are all people and we come with our own problems. I know that some students have talked to me about their own pathologies with their joints, with their bones. Please listen to your body and do what is comfortable for your body, but absolutely pay attention to joint stacking. In this third image from your book, this gentleman in the gray scrubs is leaning forward and he has less bend in his lower back, which looks much more stable to me. That force is coming through and down directly through the midline of his heel, and he can make himself go firmer into the client's tissues by bending the knee of that forward leg, allowing his body weight to drop further in. You see that his elbow is fairly locked and he is applying forward and downward pressure with the palms of his hands rather than bending at the back and just trying to push straight down with the arms. You need to push instead of pull. Lean forward to push when possible. When you push an object, you use the muscles in your legs. You're not pushing with your arms. You're pushing merely by bending that knee of the forward leg and dropping your weight into the client. When you pull, when you're tugging on a client, there's a tendency to use the back muscles to yank and to pull, and it's easier to keep your back straight while pushing. There are a few maneuvers that you will do in massage therapy, like when you are reaching and pulling on the opposite side of the back to pull some of that tissue from lateral to medial. That's a very awesome technique. It feels great on clients. That is a pulling technique, so it's not the best for body mechanics for your body. There are a few other pulling and dragging techniques, but again, experiment and work with your on-campus instructors in your palpation courses in your clinic to really get those body mechanics down pat. It will save your body a decade from now, I promise you. All right, so the body mechanics of the massage therapist that I keep blathering on about is ergonomics. Ergonomics is an applied science concerned with designing and arranging things so that people and things interact most efficiently and safely. It's also called human engineering. Ergonomics is based on the principle that the job should be adapted to fit the person rather than forcing the person to fit the job. It focuses design and function of the work environment. Ergonomics includes restructuring or changing workplace conditions to make the job easier and reducing stressors that cause cumulative trauma disorders and repetitive motion injuries. For massage therapy practice, ergonomics involves the massage table's height and the width and the size of the massage area, the space around the massage table, temperature and ventilation, uniforms, shoes, access to equipment, scheduling, and rest breaks. It's everything you can think of for your comfort during the massage and in the massage environment. So it is not specifically your body mechanics, but the way your body mechanics relates to the environment around you. I worked in an incredibly tight office before, where I was backed up into a corner to work on anyone's feet. So I ended up kneeling on the floor to do their feet. So I was not in this painful half squat with my back bent to work on anyone in their lower leg or their feet. I had worked in another office that was a little bit bigger, and it allowed me to literally put my legs against the wall for extra pressure when I wanted to do deeper tissue work on the back or the glutes. And then I've worked in offices that are absolutely massive, but they had slippery floors. So I had to make sure to use shoes that had a lot of traction to be able to keep myself from slipping or from having to use a lot of upper body pressure instead of just being able to bend my legs and lean down to cause increased compression during the massage therapy session. These are all things to keep in mind. Okay, so because biomechanics is the science concerned with the internal and external forces acting on the human body and the effects produced by these forces, we need to understand the properties of force. So what is force? Force causes change. Forces push or pull on an object in an attempt to affect motion or shape. The human body moves because of internal forces, such as muscle contraction, and external forces, such as being pulled by a dog on a leash or being pushed by your therapist. Therapeutic massage purposefully applies external forces to trigger change in the homeostatic mechanisms of the body. Forces generated by massage load soft tissue and create tension, torsion, bend, shear, and compression, stress, and strain. The term stress, when related to biomechanics, describes force applied to a certain area of an object that will not move. So instead, that applied force causes deformation, which is a change in shape. Strain is the response of the object to an applied stress. When a material is loaded with a force, it produces a stress, which then causes a material to deform, which is the strain. So I am pushing on someone's leg. I am pushing on the back of their thigh, the posterior portion. I am pushing down on the hamstrings. It is compression. It is a compressive force, and the tissue spreads. That is stress. The tissue has nowhere to go. It cannot go further downward because the bone is there and then the table is there. So the tissue spreads outward. So strain is the response of that object. So the hamstrings are under strain because of the stress of my compressive load as I'm pushing downward onto the hamstrings. A vector is the direction of the force. The magnitude of a vector is the result of the vertical and horizontal components of an applied force. Most massage application involves applying a force down, which is vertical, into the tissue, and then pushing forward or pulling back, horizontal. The magnitude of a massage application involves how much pressure is pressed down into the tissue, combined with how much force is applied to push tissue away or pull tissue towards our hands during massage application. For example, a light pressure application on the skin combined with a slight push forward has less magnitude compared to more pressure down into the muscle and tissue combined with a push forward. Mass is the amount of matter or material substance that forms or comprises a body. For our purposes, weight and mass are the same. Weight multiplied by speed or acceleration determines the amount of force. So if I am standing next to my client with the hamstring issue and I place my hand on the hamstring. The weight of my hand is making a light force onto the leg with a vertical pressure. There is no speed or acceleration because my hand is still. I am not pushing it at any particular rate. I am just resting it. So there is a light, vertical, downward, compressive force. However, if I go into archer stance and very quickly push downward and forward and bend my forward knee so that I suddenly shift even further, the weight, the mass of my body is going to significantly increase the downward and forward force that is being placed on that hamstring, and the acceleration of moving forward suddenly by dropping my knee is going to accelerate that force quite a bit. It's going to multiply the speed times the weight, and that is going to increase the stress. So when we talk about different types of stress, biomechanical stress, there's three that we talk about, especially in massage therapy. There is compression stress, which acts to shorten or flatten body tissues. There is tension stress, which acts to lengthen or elongate body tissues. And there is shear stress. It causes one tissue to slide over another. There are also terms for tissue behavior when stress is applied. Something can be called elastic. That means it deforms under the stress but returns to its original size and shape when the stress is released. There is no permanent deformation. An example would be a rubber band. I stretch my rubber band, it becomes very long and thin, and then when I relax, it returns back to its circular shape. There is viscous. It deforms steadily under stress. An example would be thick modeling clay. I'm squeezing a modeling clay and it just keeps changing. It doesn't fall apart, but it changes each time I'm pressing on it. There's viscoelastic, which combines elastic and viscous behavior. An example is yeast bread dough. There is brittle. This deforms by fracturing. Think of a potato chip or peanut brittle. Once it's shattered, it's completely shattered. There is ductile. It deforms without breaking and results in permanent deformation. Think of bending a piece of wire. Like if you twirl a piece of wire around your finger, it doesn't break, but it stays in that curling shape. Plastic. It does not deform until a threshold stress has been exceeded. So like saran wrap or plastic wrap that you put over things in the kitchen, you can stretch it and it becomes thinner until it eventually just rips in half. We never actually see the stress. We only see the results of stress as it deforms tissue, which means it changes the tissue shape. This strain on the tissue is defined as the amount of deformation a tissue experiences compared to its original size and shape. Too much strain on body tissue causes injury. We can have a longitudinal or linear strain, strains that changes the length without changing the direction. These can either be compressional or tensional. Compressional linear strain shortens the tissue. Tension longitudinal strain lengthens the tissue. There's also shear strain that changes the angles of an object. Shear strain causes lines to rotate. This is usually a significant pulling to the side. Okay, these are lots of words, but what do these words mean in relation to massage? All right, well, soft tissue is what we call viscoelastic. So an example would be gliding with moderate pressure on the skin. So then the tissue, the hamstrings, are loaded with combined compressive stress and tension stress. This causes longitudinal tensional strain, and the outcome is we have temporarily elongated the tissue. We have stretched the muscle with our compressive and tension stress. You can also knead your client with moderate drag. When that happens, the tissue is loaded with combined compressive stress, tension stress, and shear stress. This creates shear strain. You're kneading and pulling it off to the side. It is a shear strain. It temporarily elongates the tissue, but it also lifts and slides the tissue layers. A third example of soft tissue being viscoelastic is compression. You are doing compression on your client, and the tissue is now loaded with compressive stress. You get compressional linear strain. This temporarily elongates the tissue under the point of pressure application and the shortening of tissue surrounding the point of pressure application. It applies a little bit differently to injuries. So again, soft tissue is viscoelastic. So let's say someone threw a ball and it hit you. That tissue is now loaded with compressive stress. It caused a compressional linear strain, which resulted in a contusion or a bruise. But bone is not viscoelastic. It is brittle. If you fall down the stairs, the tissue is loaded with combined compressive stress, tension stress, and shear stress. There's longitudinal tensional, compressional, and shear strain that results in a broken bone. Ligaments are plastic. Landing wrong after a jump. The tissue is loaded with combined compressive stress, tension stress, and shear stress. Longitudinal, tensional, compressional, and shear strain, and you end up getting a sprained ankle and knee. Why is it sprained? Because sprained is ligament and strained is tendon. ST rained is tendon and SP rained is ligaments. Your assignments for this week covers fulcrums and levers and efforts and resistance. So I'm going to skip some of that in the lecture and jump down to muscle function. Muscles are able to function in multiple ways to meet various tasks, such as maintaining balance. Most daily activities require the coordination of complex neuromuscular interactions. Sometimes muscles are required to function for long periods without fatiguing, such as walking long distances. And at other times, muscles must provide maximal effort for only a few seconds, like sprinting or jumping. Muscles have three major actions. Remember, these are isometric, concentric, and eccentric. Muscles must be able to shorten and lengthen to provide a range of motion at joints, yet they must generate enough power to move a load at each end of the range. Muscles must be able to hold a static position to provide stability. The nervous system accomplishes the fine control of muscle contraction over a wide range of lengths, tensions, speeds, and loads. When giving a massage, we have to assess for these functions. Massage application depends on accurate functional assessment. We can observe as a muscle contracts through its range of motion. And when muscles move a joint, its ability to stabilize is decreased, and vice versa. Muscles that span a really long distance, such as the biceps brachii of the arm, are the most efficient supplying movement through a longer range of motion. Other muscles are more effective at stabilizing the joint than moving it. The supraspinatus of the shoulder joint is a good example. Its line of pull is mostly vertical and close to the axis of the shoulder joint. Therefore, the supraspinatus has a very short range of motion, which makes this muscle more effective at stabilizing than actually moving the shoulder joint. Opposing muscle groups generate parallel forces to provide stability. This is achieved through co-contraction. Muscle fascial units coordinated by the nervous system work together to support stability and mobility. The more integrated movement is understood, the more beneficial the massage. Posture is helping us to maintain our upright position in gravity. Gravity is constantly changing with each movement. Our center of gravity moves depending on how far forward we're leaning, or if we're hyperextending our trunk and leaning backwards. When we lie down, we relieve the postural muscles of the task of keeping us stable and constantly fixing our center of gravity. Efficient posture is important because it reduces the amount of stress that's placed on ligaments, muscles, tendons, and it improves functions and decreases the amount of muscle energy actually needed to keep the body upright. This week in your ABMPs, you will be doing a postural assessment activity. All right, this is in addition to your body mechanics and other ones. Postural assessment is absolutely important. I'll also be including some other videos about postural assessment. It's a very vital thing to add into your practice, especially if you're going to be working primarily in sports massage with a chiropractor or any type of medical office. One thing that you will also be assessing in your clients is gait. Gait is defined as the rhythmic and alternating movement of the legs along with the trunk and the arms, which results in the propulsion of the body mass. Gait is an automatic function coordinated by innate and learned reflexes. Gait is not simply walking. Muscles work together to produce movement, but an interesting note is that in large portions of the gait cycle, little or no muscle activity occurs in most of the muscle groups. This points to the energy-efficient nature of walking. A gait cycle is the period during which a complete sequence of events takes place. It begins when the heel of one foot strikes the floor. The gait cycle is subdivided into the stance phase and the swing phase. The stance phase occurs when the limb under consideration is in contact with the floor. During walking, a period always occurs when both feet are in contact with the floor. This is called double stance. The swing phase occurs when the foot is not in contact with the floor. In an average walking pattern, the stance phase takes about 60% of the gait cycle and the swing phase about 40%. As the speed of walking, also called cadence, increases, the length of time in the stance phase decreases. Double stance time increases with slow walking. The components of the stance phase are heel strike, foot flat, mid stance, heel off, and toe off. The components of the swing phase are acceleration, mid-swing, deceleration, and arm swing. An assessment and intervention protocol is found at the end of your chapter, and you should really check it out. I also highly advocate checking out some of the modalities that really work with gait cycles and retraining the body. There are entire modalities to help you retrain the gait cycle. Very often, a lot of times, people that have plantar fasciitis and other abnormalities, tightness in the fascia, or various pathologies, even like things starting from shin splints that bleed off into other issues with tight fascia, they will have an impaired gait cycle, and the components of the stance phase will be out of order. So instead of being like heel strike, foot flat, mid stance, heel off, and toe off, you'll see those slightly out of order. And if you are interested in footwork at all or pathologies of the lower leg, Now, please remember, a lot of these are the cause of low back pain and back pathologies that we see with increased postural deviations of the spine, especially hyperlordosis, can be caused with issues with the gait cycle. If you have excessive pronation or inversion sometimes of the feet, you're going to see this gait cycle completely off. So if you are interested, reach out to me. I can help you find some material that delves into this deeper. But this is really, really interesting stuff. So we're just going to take a brief look at kinetic chains because this is your major assignment of the week, is about kinetic chains. This is an integrated functional unit. It's different from previously described open and closed kinetic chains, which refer to a single or multiple link joint function. The kinetic chain network systems of the body involve human movement. Kinetic means forces, and chain means connected or linked together. Specifically, a kinetic chain is made up of the myofascial system, muscles, ligaments, tendons, and fascia, articular system, so your joints, and your nervous system. Each of these systems work interdependently to allow structural and functional efficiency in all three planes of motion: sagittal, frontal, and transverse. If one or more of the systems do not work efficiently, compensations and adaptations occur in the remaining systems, which leads to stress in the body and eventually resulting in the development of dysfunctional patterns, which also leads to dysfunctional posture, which will affect the position and forces on all other joints and associated soft tissues. So we're really talking about a snowball effect. All right, we're going to be covering joint assessment. Well, how do you know if a joint's even working correctly, right? One of the first things we're going to check for is a range of motion. Range of motion of a joint is measured in degrees. So when we look at a full circle, if you remember from school geometry, that is 360 degrees. A flat horizontal line is 180 degrees. Two perpendicular lines, like if you make a capital L or you make a cross, they create four angles inside of the cross that are each exactly 90 degrees. So various ranges of motion are possible with different joints in the body. The range of motion of a joint allows 0 to 90 degrees of flexion. Anything less than your body being able to do 90 degrees is hypomobile, and anything more is hypermobile. A great degree of variability exists among individuals as to the actual normal range of motion. So the range of motion degrees that you see in guides and in your textbook, they're more of a general guideline. Everybody's body is different. Now remember, when you're doing an assessment, range of motion is always measured from the anatomical position. Regardless of whether your client is standing, supine, side-lying, anatomical position is considered the 0 degree range of motion. So when you assess your client, you're going to apply resistance. You're going to put pressure against the muscle. And it's focused at the end of the lever system for mechanical advantage. So, for example, when you're assessing the function of the shoulder, you focus resistance at the distal end of the humerus, not at the wrist. When assessing extension of the hip, you place resistance at the end of the femur. When assessing flexion of the knee, you place resistance at the distal end of the tibia. The massage therapist always applies resistance slowly, smoothly, and firmly at an appropriate intensity determined by the size of the muscle mass. Now, what does this mean? Again, when you are assessing the shoulder, you're going to be putting resistance just above the elbow, because you're working on the humerus. You're not working on the entire limb. You're only working on the functional joint that you are trying to assess. All right, another component that you need to be aware of is stabilization. Stabilization is essential to assess movement patterns accurately. Allow only the area being assessed to move. When people move other parts of their body, it can assist and help turn them, and it might be a false sense of extra range of motion. Potentially, they could be moving away from the movement, and then you're going to think someone has hypomobility. Make sure that there is no movement, all right? Movement in any other part of the body needs to be stabilized. Usually, the massage therapist applies a stabilizing force. For example, as one hand applies resistance to the joint, the other hand provides the stabilization elsewhere in the body where it needs to. If you were assessing that shoulder joint again, you might place a stabilizing hand by the clavicle and over the pecs, a little bit in that upper area right before the shoulder joint. And then you would be putting your resistance with your other hand right at that distal end of the humerus, right superior to the elbow, all right? The easiest way to identify the area to be stabilized is to move the area to be assessed through the range of motion. At the end of the range, some other part of the body will begin to move. That is the area that you need to stabilize and place your hand. Return the body to a neutral position, provide the appropriate stabilization to the area identified, and then begin the actual assessment procedure. So you're going to first grab the shoulder, rotate it, then you're going to watch for movement in the upper chest and near the clavicle at the end of the range of motion. So you're going to put the body back into neutral. You're going to put your hand over the pecs and clavicle there to stabilize the upper body where the shoulder joint begins to move the body. And you are then going to do your assessment of the shoulder joint. Okay, we're going to do a brief review of biomechanics by body region. So when we're talking about the head and neck region, we're talking about the head and the thorax. It's the C1 to C7 cervical vertebrae, the spinal cord. There are 32 muscles, ligaments, as well as everything inside of the throat and neck and the spinal nerves to be considered in this area. The cervical vertebrae allow the head and neck to be moved into flexion, extension. Now remember, flexion is forward, extension is back towards the back, lateral flexion, so that's bending side to side, and rotation, you can turn your head. Combinations of these movements are also possible. The small bodies and thick discs of the cervical vertebrae tend to increase mobility. Our body has certain balance points. 2 of these are in this head and neck region. One is at the atlas and the skull connection, and one is at C6 where it connects to C7. The muscles of the erector spinae group are considered stabilizers of the spinal column. These deep muscles extend, rotate, laterally flex, and stabilize the cervical region. I'm on 510 in your book, page 510. I highly suggest you go through these sections in detail, perhaps creating flashcards or highlighting for future use. The specific muscles utilized for flexion or extension, lateral flexion, and rotation are listed for each of these regions, and I highly suggest going through and deeply reading starting on page 510 in your book. All right, so the trunk and thorax region are, the biomechanics are pretty unique in this area. There are 24 intricate and complex articulating vertebrae and 31 pairs of spinal nerves in this area. The motion is the greatest in this area, where the articulating surfaces and discs in the vertebrae are large. The more surface area, the more ability to rotate. One of the most versatile regions is the shoulder region and shoulder girdle region. The framework of the shoulder is extremely mobile, but also secure. It is an immovable point for specific actions like lifting, thrusting, shoving, and pushing heavy objects. All right, the shoulder girdle is made up of the scapula and the clavicle, which usually move together as a unit, and all of the soft tissues. The movements of the sternoclavicular joint include elevation, depression, rotation, protraction, and retraction. So elevation is when you're shrugging your shoulders up, and depression is dropping them back down. Rotation is turning them. Protraction is pushing your arm forward, and that scapula slides forward, and then pulling your arm back behind the body. That is scapular retraction. One of the prices of extreme mobility in the shoulder joint is instability. The concept that the more mobile a joint is, the less stable it is, and the more stable the joint is, the less mobile it is. So you see a lot of patients coming in or clients coming in with shoulder injuries, frozen shoulder, neck pulls that began at the shoulder joint or in that sternoclavicular area. This is because of the extreme mobility afforded by the shoulder, making it less stable and more prone to injury. The more moving parts there are, the higher the chance of damaging it. So what is a stable joint? An example of a stable joint is the elbow. It has firm osseous support, osseous meaning bone, and is composed of 3 articulations. It is a uniaxial joint. It is a hinge joint. That means it moves in only one plane along a single axis. The action of the elbow is flexion and extension of the arm, and the elbow is capable of moving from 0 degrees of extension to approximately 145 to 150 degrees. This is not a full 180. I would like you guys to check out activity 10.2 in your book starting on page 522. And throughout this week and the next couple of weeks, definitely try to do some of these assessments, isolating the arm, the leg, the knee, whatever joint that you want to check, and check for range of motion. Do an assessment on the range of motion, the joint stability, and whether or not your client has full range of motion in that joint without any dysfunction, discomfort, or pain. As we pass activity 10.2 in the book, it talks a little bit about the pelvic girdle and the hip joint region. Your pelvis consists of 3 bones and 3 joints. The bones are the 2 fused coxal bones, which are made up of the ilium, the ischium, and the pubis, as well as the sacrum. The 3 joints are the 2 sacroiliac articulations in the posterior portion of the girdle, and in the anterior portion is the symphysis pubis. This is that little cartilage holding you together in the front. The pelvic girdle functions as a single unit with all 3 bones moving at all 3 joints. The pelvic girdle moves back and forth with 3 planes for a total of 6 different movements. Now, the pelvic girdle is ripe for issues, especially as people age. Sometimes these synovial joints, they permit little movement, and they may even fuse in people as they age. This general reduction of motion is related to degenerative changes, such as osteoarthritis. There are 4 groups of ligaments that form the main bond that keep the ilium and sacrum in approximation. Stability of the sacroiliac, you'll often hear them referred to as the SI joints. When you hear SI joints, they're talking about the sacroiliac joints, is crucial because they maintain support for a large portion of the body weight. They're holding up the entire upper body. More movement and less stability is present in the sacroiliac joints of women who have smaller and flatter surfaces involving only the first 2 sacral vertebrae than in men who have longer, more concave surfaces, and they articulate with the first 3 sacral vertebrae. I highly encourage you to look at page 529 in your book, which goes over the muscles of the hip girdle in detail. These are going to be very important for you to know if you're interested in sports massage or any type of postural or stability work. If you work in medical massage, you're going to want to know these by heart. Obviously, even if you're going to be working in a spa or you're primarily concerned with energy work and relaxation work, knowing how the body stabilizes and works together is absolutely essential for your massage therapy career. Now, just after this, scrolling down all the way through page 537, there is activity 10.3. Please practice these with a partner. We're looking at forearm pronation and supination. We're looking at wrist and hand movements. Your wrist and fingers are extremely complex joints that allow for a lot of fine motor movements that most of the other joints in the body do not. So these are good exercises to try. We're going to finish this off just by making a small note of the movements of the ankle and foot. As a refresher, dorsiflexion is the movement of the top of the ankle and foot towards the anterior tibial bone, accomplished by the flexor muscles of the ankle. So we are pointing our toes up towards the sky. Plantar flexion is movement of the ankle and foot away from the tibia, accomplished by the extensor muscles of the ankle. With plantar flexion, we are planting our feet to the ground. We are pointing our toes downward. Eversion or pronation of the foot is turning the ankle and foot outward, away from the midline, with weight on the medial edge of the foot. So imagine that you're standing on the medial edges of your foot and the sole of your foot is pointing outwards. Inversion or supination of the foot is turning the ankle and foot inward, towards the midline, with weight on the lateral edge of the foot. So you would be standing on the lateral edges of your feet with the soles pointing towards each other. Toe flexion is movement of the toes towards the plantar surface of the foot, and toe extension is movement of the toes away from the plantar surface of the foot. So toe flexion is curling them down and towards the foot, like rolling them into a ball, and toe extension is lifting your toes up and making your foot as long as possible. I'm going to end it there. You have plenty of assignments to keep you busy this week. I do, again, highly encourage you to look at all of the activities in this chapter. You can do these activities by yourself to check your own range of motion without resistance. Just going through active range of motion on your own, moving each joint of your body. I absolutely cannot recommend highly enough doing this. Hopefully on a massage bed, or in a chair, or in your bed at home. Sit down and go through all of these ranges of motion, lay supine and go through them again, and say what the movements are. Flexion or extension, lateral flexion, any of these things as you go through all of these motions to not only help you remember what the particular rotation or flexion is called, but also to give yourself your own assessment. Are you feeling any discomfort? Do you have a lowered range of motion somewhere and didn't realize that you did? And think about how your clients are coming to you not as 100% healthy individuals all the time, but with restrictions, and what that might feel like having to work on them on the table. Try going only halfway through your range of motion as you get up and walk around the house. See how well you function with a limited range of motion. Put yourself in your future client's shoes and try to do some of your activities of daily living with limited range of motion. This will help you further understand what muscles you might need to work on for your clients, or what you might need to study to learn about if you're interested in working on a particular pathology of the body or joints. Have an excellent week.